I'm very pleased to see so many people here, and what I've been asked to do is to give an introduction to the West of England Academic Health Science Network. And I am Deborah Evans. I have just completed several years as Chief Executive of NHS Bristol Primary Care Trust, and more recently its neighbours in South Gloucestershire and North Somerset. And I am currently leading the development of the West of England Academic Health Science Network. So the aims for today are in front of you. There is going to be a bit of explaining what this new thing, Academic Health Science Network, is about, but it's also very much about drawing on your experience to understand how best we can get patient and public involvement in our new networks. So just talk about who invented Academic Health Science Networks and why do we need them? What problems are they trying to solve? Just over a year ago, a report was published called Innovation, Health and Wealth. Not published by the Department of Health, but published by the government. It was the result of a working group chaired by Sir Ian Carruthers, the Health Authority Chief Executive for the South West. And what it said is the NHS is far too poor, it's too weak at implementing proven good practice. You can have best evidence-based practice in one hospital, and in the next hospital they're not doing it. I think many of you might have lived experience of this issue in the health service. It happens in mental health, in community services, it happens throughout the NHS. We're just not good enough at spreading good practice and then embedding it and making sure that we have very consistent, high-quality care. The report also said the NHS should be much better at generating relevant research questions and getting that research into practice, engaging patients, making sure patients have the right to be offered the opportunity to be involved in research, and then when we get the answers to our research, that we put that into practice. The report also said that the NHS could work much more effectively with industry to create jobs and wealth in ways which also are producing better NHS services and NHS products, as it were. So it was a very challenging report, and it thought that one of the answers, there were lots of recommendations it made, but one of them was that we should create academic health science networks. And these are networks primarily of NHS providers. So this is our NHS trusts, but also recognising that in the West of England, many of our community health services are now run by social enterprises, and several of those social enterprises are represented in that room, in this room, but also, increasingly, a lot of healthcare is provided by independent sector organisations. And just as with the NHS, they need to be very good at spreading best practice and adopting best practice. So it's primarily a provider network, but you will know, as I do, that it's very important in the NHS, if you want to make change, to get all the ducks in a row. So, for example, things that have been identified by the local authorities as priorities in the Joint Strategic Needs Assessment for a local area, and also have been adopted by commissioners as their priorities, can be reinforced in lots of ways. For example, through quality payments, which we call sequin. So it's really important that in addition to the providers, we are engaging with commissioners, clinical commissioning groups, and the National Commissioning Board, which now has an area level of organisation called Area 2. It is intended to be a network of peers. That doesn't mean to say that the NHS isn't going to turn around to academic health networks and say, we've got some must-dos and we want you to be part of the implementation. Of course, in the real world, we know that that will be the case. But the intention is that it is a network and not a hierarchy. I'm saying this to you because people are always saying that to me. Okay, so who is the West of England Academic Health Sciences Network? Well, it's the providers in Gloucestershire, Swindon, Wiltshire, but not Salisbury Hospital, which will be part of the next door AHSN in Wessex. It's Bath and North East Somerset, and isn't it lovely to be in Bath today? It's Bristol, North Somerset and South Gloucestershire. So we are the West of England, and I think we've got a bit of a mixed history in terms of working together. We're not just one health community, we're several health communities. And some of our organisations, particularly some of our mental health trusts, straddle those areas. So we've got Avon and Wiltshire Partnership, and we've got Together, we've got the Great West Ambulance Service, which is now part of an ambulance service serving the whole of the South West. So we've got some organisations which span the boundaries, and as I've mentioned, we've got our social enterprises running community health services. We've also got 6 clinical commissioning groups who will be involved. And the challenge for all our provider organisations is, can we work successfully with our 4 universities, that's universities of Gloucestershire, Bristol, University of West of England and Bath, and can we work with the myriad of partners in industry to achieve all the vision that was launched in improving health and wealth. Just one thing to say about engagement so far. I have been really impressed by the way in which we've got partners from the whole of the area involved. That's very striking, and I'm very encouraged that all the NHS trusts are putting their senior people in. Another thing which is really striking is that a lot of clinicians are really spotting the potential for this. It's really interesting that a lot of clinicians are the people that are coming forward and saying, hey, I think this could be really good for our area. And they might get in touch to say, hey, I work on this area and I think that we can spread good practice much more consistently, or I've got research ideas, or why don't we improve take-up in a certain way. So clinicians, for some reason, really get it, and that's encouraging. And the other thing that's been really heartening is that all 4 of the universities are really involved in this, and they clearly see the potential for it in terms of research and in terms of their mission and their relationships with the NHS. Universities are keen to be close to the NHS. I know some of you are from clinical commissioning groups, and that's fantastic, because one of the things that is difficult in these early stages, when clinical commissioning groups are racing to get authorised, and we are racing to become an academic health science network, and the National Commissioning Board is racing to get all its people appointed, it's difficult to get engagement. So people from CCGs, I'm especially pleased to see you here, and I would be delighted if you would go back to your organisations and tell your organisations about the AHSN and encourage them to become actively involved. So moving on to our vision, I'm just going to read this out because I hope it will strike a chord with you. We see ourselves as a vibrant and diverse network of partners committed to equality and excellence. The West of England AHSN will accelerate the spread of innovative evidence-based practice to improve health and care quality. This will bring economic benefits through increased regional investment, job creation and effective procurement. I think that's quite inspiring, but it's a bit scary as well. That is what we're trying to achieve. And our values, we've summarised them in these 4 words: connecting, collaborative, catalytic and challenging. And I hope it gives you a sense of how open and responsive we want to be. We've got a strapline that goes with each of these 4 words, and one of the things we're reviewing at the moment is whether those are enough to sufficiently capture the way in which we want the AHSN to be patient-led and patient-centred. So we need to reflect a bit more on that issue. Now, we've also adopted some guiding principles, and I can thank University College London, UCL partners, because the principles in this slide originally came to them. And I think there's just a couple of things that I wanted to say on these principles. Our first one is about being patient-led. And in talking about that, and the whole purpose of today is to say, how can we actually become patient-led? We recognise that both the NHS and the research communities, the universities, already have extensive patient and public involvement. And so the question for us that we're going to be talking about today is, how do we add value to that in the AHSN and not replicate it? Because we'll drive ourselves crazy. We haven't got the time or money to be repeating things that are already being done. So it's how to make sense of what is already a very rich pattern of patient, service user, carer, public engagement. Just keeping moving on then. Our task is to develop an academic health science network, and when the chief execs and of the NHS Trust and the universities first sat together with partners and talked about this, they said, actually, what we'd like to do is spend a bit longer developing the network, and then we'll launch ourselves. And they had that conversation with colleagues in the Department of Health, and then it turned out that everywhere else in the country, people wanted to get themselves launched and go straight away from the 1st of April. So we were asked not to spend quite so much time developing ourselves and accelerating and get approved. So we're on a very fast path now. The good side of it is that this event is well timed, because nothing is set in stone. It's really good to have engagement right from the beginning, isn't it? We have to write a prospectus about what we're going to do, and this week is prospectus week. We're finalising that prospectus this week, and then we have to go through an assessment process, and that happens in the middle of February. And we hope that we will be authorised to start either from the 1st of April or between April and June next year. That means that the real process of engagement and development happens after we've been approved and not before. So that's what we're up to. We have been asked to identify some initial priorities in our prospectus, things we are going to do in year 1, or start on in year 1, recognising that AHSNs have initially a 5-year lifespan and then the possibility of renewal. So this is just about talking about what we should start off with. So in conversation with partners, these priorities have come out, and the reason they have been chosen or nominated by the NHS trusts and so on is because they feature in the Joint Strategic Needs Assessments, they fit with the Commissioner's top priorities, and or they're areas where we're seen as not doing as well as we should be doing. So I don't think there are any surprises in these, and I hope none of you would look at them and say, I don't recognise any of those as being priorities for my area. Now, one of the things that we have to do is we have to develop a process by which we'll adopt new priorities, and also we have to define some of these. So, for example, with mental health, we thought that our best engagement principles mean that 3 people in a room shouldn't just determine what the mental health priority is going to be. So we're going to have a mental health summit early in the next and that's the mechanism through which we're going to have a good engagement process before adopting a priority. So some of these things are going to be launched in different ways. On patient safety, I just wanted a word on that. We are hoping to adopt and develop the South West Patient Safety Programme, which the Health Authority ran and which is very highly regarded. It works in acute hospitals, it works in mental health, and it works in community services. So it's a good one which can span interests right across our AHSN. And just to give an example about how we might work, in that case, the Royal United Hospital in Bath are volunteering to be the lead partner and to coordinate the efforts of all the other organisations. And we think it's a good model for a network to ask for different partners to take a lead on different things, because we're not planning to have some core team that does all the work for everybody else. That's never going to work. That's not a network, is it? So that's initial priorities. We also have, and you would expect this, a series of enabling programmes, of which patient and public involvement and this particular event is one. So I'm not going to run through them all, you can see them, but I hope there are things that those are things which you think are the right sorts of things that we need to do. And of course it's really important, the bottom one is engagement. And of course it's really important, isn't it, with a changing landscape in the NHS, enormous changes coming into effect. New bodies like Health Watch, new bodies like the National Commissioning Board, new bodies like an Academic Health Science Network. It's really important that we talk to people about all of these things and try and work out how we all fit together to make a really good and effective health service. So just in summary, the West of England Academic Health Science Network is being created to improve health and healthcare delivery. And although it's a provider network, as you know, I come from a commissioning background, so thinking about the population as a whole that we serve is really important to me. And I hope that we will find that some of the priorities and certainly the ways that we work will be informed by a population-wide perspective. So it's improving health and healthcare delivery. It's about stimulating wealth creation through closer working between the NHS and industry. It's about working very closely with our researchers and research partners, being able to generate good research questions and then getting research into practice and helping care to become more consistent and high quality right across the NHS.